the Awaken Your Ego podcast with Joanne and Ariana. We are a health podcast that explores topics to do with biohacking and self-discovery.
We are also on the self-discovery journey, and we want to attract listeners that are doing the same in order to help them realize they're not alone.
Ego differs from conventional medical spas and wellness centers. We believe that the secret to maximizing one's sense of self is in addressing the entire person, inside and out. We provide state-of-the-art aesthetic treatments as well as lifestyle management and holistic health solutions. We aim to please with our efficient and friendly customer service and guarantee with our scientifically proven alternative therapies and lifestyle optimizations that every patient will leave our care with a boosted ego. Our goal is to help our patients realize the necessity of self-care and to encourage them to prioritize their health and wellness goals. When we make self-care and confidence a priority, then we're able to bring to light our potential for happiness and growth. This podcast is a way to expand our reach so that we are able to spread the word on the importance of self, the whole self, inside and out.
This podcast is for educational purposes only. Please reach out to your medical provider if you have questions about any of the treatments we discuss to see if it's a right fit for you. Now on to our show. Hi everyone, and welcome to another episode of Awaken Your Ego. We are so excited to have Dr. Rhoades returning on this podcast episode. So welcome back, Dr. Rhoades.
Thank you.
So we wanted to get into a little bit of functional medicine. For those of our viewers who don't really know what that is, Dr. Rhoades is a functional medicine practitioner. So functional medicine is a systems biology-based approach that focuses on identifying and addressing the root cause of disease. Each symptom or differential diagnosis may be one of many contributing to an individual's illness. Functional practitioners work through a holistic approach, meaning they consider the full picture of your physical, mental, emotional, and sometimes your spiritual health, considering factors such as diet, genetics, hormone changes, prescriptions, over-the-counter medications, as well as other lifestyle factors. And at Ego, we basically promote functional medicine or a holistic approach to healing the patient. So, Dr. Rhoades, how long have you been working as a functional medicine practitioner?
You know, Joanne, it's hard to say. I finished my residency in 1993, and I feel since then I've been doing some measure of functional medicine in the sense of, if you think of it like this, you know, functional medicine being helping to improve a patient's function, like that their lives are better. Not just dealing with one specific symptom or one specific organ system, but how everything works as a whole. But probably really it's been, for me, maybe 20 years.
Wow, it's impressive.
Oh, definitely. So I know you started out specializing in pain management. What inspired you to go more of that holistic route, to open a wellness center? What made you want to kind of change your approach to how you're treating your patients?
Well, you know, a lot of different things. So I could see that a lot of my patients weren't improving or weren't making lifestyle changes that were making them happier. So that was part of it. And many years ago, I attended my first meeting of the American Academy of Anti-Aging Medicine, and that's basically an anti-aging or functional or integrative medicine organization. And then going there and hearing all the different speakers talk about different things inspired me and made me think, we need to do more of this. And then I went to a place in Arizona and actually got checked out. I believe it's called Cenogenics. And, you know, got tested and all these kind of things. And so that piqued my curiosity even more. And then we decided, hey, we need to incorporate this into our practice. And so probably since then I've been doing that.
Mm-hmm. Oh, that's awesome.
How do you feel about the overall evolution of what your wellness center has grown into? And for those who aren't familiar with Ego, it ranges in services such as IV and vitamin therapy, hormone balancing, peptide therapy, stem cells joint injections, also known as regenerative medicine, and a wide range of lasers, full menu of skincare services, body sculpting. We just incorporated Reiki and consciousness coaching. We have weight loss programs, as well as aesthetic services such as Botox and filler injections. Literally, it's the one-stop shop for all things beauty and wellness. So how do you feel about how it evolved from just the wellness center to basically a center of beauty and wellness?
Well, it probably originally started, again, when I went to the American Academy of Anti-Aging Medicine. And what we really started doing is I bought a laser and we started doing injections. So we started doing some beauty things. But then once we incorporated that, we decided, no, let's do some of these other things. And we started doing some hormone replacement therapy and then a lot of different things. And then over time, we've acquired we have a naturopath now, Dr. Nina, who is fantastic. And she has a different education and a different outlook than I do. We have had nurse practitioners that work with us that get into line. And for a long time, we had Dr. Lisa Hunt working with us. And she really, I think, helped really establish who we are as a functional medicine facility. So she saw a lot of people for a lot of years, and I have to give her a lot of credit for that. But since she's left, we have continued to grow and do a lot of different things. I think we've looked at what is recent and on the horizon seems to be working. For example, the semaglutide and tirzepatide. I think we got on the front wave of that. It was very helpful for a lot of people. We've had many patients come in and lose significant amounts of weight and feel much better about themselves and feel better themselves. Personally, I enjoy the hormone replacement therapy. I think that's one of the things that is most fun in watching people's lives change, their outlooks and how they feel and how they look and all those kind of things. But, how we added we just kind of added one thing at a time. We found something, the platelet plasma we started doing, and then we brought on Barb Hopkins, our nurse practitioner, who's very skilled in stem cell injections. And I don't know, we've just added a lot of different people over time, looking for things we think that are real, that are helpful to people. We're not doing it to make money, we're doing it to really help people, and because I feel that's the only thing that'll last, that'll be sustaining. And we've grown into offering quite a few services.
Mm-hmm.
In your experience with wellness services, what are most of your patients looking for when they're kind of coming in to see you?
I think, in a nutshell, they're just looking to feel better. I think both men and women, I just want to feel better. I'm getting older. I'm in my 40s. I'm in my 50s. I just don't feel as vibrant as I used to be. I just don't feel good, and I want to feel better. I mean, that's the one overarching thing I think people want, is to feel better.
Well, and I love that our patients at Ego, they are really all about, like you're saying, optimizing. Like, okay, I'm surviving, like I'm fine. There's no real big injury or anything kind of that I'm staring at. But it's like, I know I can feel a little bit better. And so I think a lot of the services you provide with like peptides, regenerative joint injections, BHRT, like all of those wellness oriented services really help optimize one sense of being, health. Even I've noticed personally with the Reiki and consciousness coaching, how like getting your mindset right and looking at things a little differently can make you feel like a weight is removed, and so you have a more vitality for life and you're more excited to kind of get after things. And
well, I do think with the varied services we offer, we can kind of tweak certain little things, like perhaps everything's going along physically, but mentally they don't feel well. So we do the consciousness coaching. Or, shoot, I just don't feel good, and their body habits and everything looks good, but realize their hormones are out of balance. Or even just, I hate these wrinkles, and we do a little Botox. I mean, all these things tend to help. Or I'm having pain, and then we do the PRP and hyaluronic acid injections in their knees, and they feel better. We try to figure out what the problem is and fix it so that overall they are doing so much better.
And I feel like there's a lot of patients too who, when they go to their primary care physician or their regular traditional medicine, on paper their labs say that they're fine, but they don't feel good. So I feel like that's kind of where we differentiate between other physicians or other practices, is because we go down to the source of the issue. Like, I know not a lot of other physicians go into detail as far as all the hormones or thyroid or even checking vitamin D it's not really routine. So I feel like that kind of sets us apart too.
Well, and I think it's how they look at labs, because they're looking at, within normal limit labs, which are set in a pretty wide array. So like, almost everything is within normal limits. They, it's 2 standard deviations, which is 98% of the people. So you have to be really off to be outside of that. But what we look to obtain is to get people in the upper quartile. For example, testosterone generally for men should be somewhere between 250 and 1100. And if you go to your traditional allopathic doctor, he's going to say, well, you're at 300, you should be fine. You're like, I don't feel fine. My libido's down. I depressed all the time. I just don't feel great. And they come here and we give them some testosterone, give them about 800-900. Then all of a sudden, now I feel good. I am energetic. I feel better. My ED is gone. Just whatever, lots of things.
Well, and I think what a lot of people don't realize, like maybe through the Quest labs or whatever labs you're getting, it's like the lab creates averages based on the population you're being tested against.
Absolutely.
And it's like, do I want to be judged based on just the population of Modesto, California? It's like, no. Like, why am I settling for this range when it's like, if I optimize a little bit, like you're saying, get to that upper quartile of whatever that measurement is, and I'm feeling great, then awesome. So I think a lot of people don't realize, like, just because it says normal doesn't mean it's normal for you or the best you could be.
No, absolutely. And I think when you get involved with insurance companies and everybody else, they want to pay so that you're within this normal limits. And I know a lot of obstetricians and endocrinologists probably feel like, no, if you add too much, we're going to have trouble down the line. But the reality is testosterone replacement, estrogen replacement, excuse me, as long as bioidentical hormone replacement is very safe and actually helps improve longevity and organ function, et cetera, et cetera. So I just think we can do a lot by not just going by what the allopathic medicine would say, which is just get somebody within normal limits and you're okay, just live with it, versus, hey, we don't want you to live with it. We want to get you to the optimal level. Now, if we get all your hormones to the optimal level and everything going on and we've checked everything and you're good and you still feel that way, well, then that's probably all we can do. But, I mean, I personally like to leave no stone unturned until we figure out, that everything's, all systems are go for you having a positive and happy life.
What would you say are the most important factors you implement with your treatment plan when it comes to optimizing your patient's health and wellness?
To be honest, if there was one thing I had to pick, it would be testosterone therapy, both for men and for women. And I think almost more important for women, because both men and women, when they feel so much less depressed, it's not just about libido, and everybody thinks about libido, but their strength, their body fat, all this kind of stuff. They just feel so much better on testosterone. That one hormone there just makes people feel so much better, so much more alive, and so much more desirous to go out and play sports or go hiking or do all those kind of things. That one thing makes them feel so much better.
Well, I know a lot of people have weird preconceived notions with what testosterone does, right? A lot of women are like, I'm going to start growing facial hair and, look like a man. And so I guess what is a good age or a time in like a woman's life to start getting those levels tested?
I think any time is good to get tested. Now, I saw a young lady who was 25 last week, and we didn't add any kind of hormones to her. I mean, she's 25. All her ovaries are working and everything else is working quite well. But we did add a few different things to tweak how she's feeling, etc. But for the most part, I think women and men, once you start hitting your 40s, it's good to take a look at that. The testes don't work as well. Sometimes estrogen gets a little low. Just helping people feel optimal. And thyroid sometimes function doesn't go well and you're less energetic, you put on weight. I mean, there's a lot of different things that we look at. So I think, especially in your 40s. Now for 30s, for example, especially men, they start having some testosterone issues. Instead of giving them testosterone, probably give them HCG, human chorionic gonadotropin, and then that way will help their testes, which are still young, to kick in and make their own testosterone. and also keep their fertility up. Whereas when you give exogenous testosterone, the fertility level goes down, stuff like that. I mean, so for example, we had a guy that was in his late 40s, and he had a new girlfriend, and they wanted to have a baby. And he was on testosterone, but we pulled him off testosterone, gave him the HCG. It didn't work quite as well because his testes are old, but it worked well enough, and it also increased his production of sperm, which allowed him to get his fiancée pregnant. And then they were able to have a baby, and everything went well. And then we went back on regular testosterone.
That's
so
awesome.
that he could feel more vibrant and energetic and enjoy his golf game and his work game and feeling like he's going to take over the world.
No, that's awesome. And even as a woman, like I'm currently take the tiniest dose of testosterone, but it does make a huge difference. Like you were saying, energy level, libido, even just passion and like wanting to get after it. I missed a dose, I think for like 2 weeks. And then I took it on Monday this week. And I woke up the next day and I was like, gosh, like I'm excited. Like I'm actually like, pumped to like go to work and get things done. And like, why have I let myself get in this funk? So I suggest to my friends, because I'm in my early 30s, like anytime you have a baby or like have these huge hormonal shifts, it's like get those levels tested, and so you can find your new normal and get them balanced. Because I know a lot of women go through some crazy. I mean, pregnancy in general is just a crazy life shift and a lot of changes. But I feel like the hormone change that can really mess you up and affect everything.
Even being on birth control. I mean, learning that what birth control's side effects can do and how much it can actually deplete you, like the B vitamins, and also throw off all the other hormones. What would you say is your approach for balancing out hormones in male and female? I guess the question is more so is what can we do to help promote normal balancing?
Well, generally, birth control is not bioidentical hormones. It's ephedrone or progestin or other different things that aren't bioidentical. So ideally, we get people off of the birth control, and then we look at their labs, and then we replace any deficiencies with bioidentical hormone replacement therapy, which, by the way, a lot of people have. There was a study some years ago, and I forget the name of the study, but it showed that people on birth control pills had higher incidence of breast cancer. Well, when we find out, or on hormone replacement therapy, but those people were not receiving bioidentical hormone replacement therapy. They were taking progestin and Premarin, which is pregnant mare urine, kind of thing. And so those kind of things aren't the same. They're not apples and apples, So any studies that have been done using bioidentical hormone replacement therapy has not shown any increase in any problems. Another big thing is a lot of people feel like testosterone is going to mess up your heart. Actually, it works to improve your cardiac function. And it does not add at all to your coronary artery disease. I mean, it's good for you. These things are good for you.
I guess in society, it's kind of crazy how, and we don't have to go on this topic, but how women are responsible for birth control almost. It's like, and again, I feel like all adults are responsible. If you're dabbling, like you should, take some preventative measures if you're not wanting a baby to be the outcome. But I guess, what do you counsel your patients that are obviously feeling the side effects of being on birth control, sick of the ups and downs, or feeling off? How do you educate them, I guess, on the importance of seeking out alternative methods that aren't like a pill?
To be honest, the most of the patients I see are not currently using birth control. They're not at that young age where they are feeling like I need to use birth control so I don't have any more babies. I mean, by then they're done having babies and they're wanting to get on something so they feel much better. That's a hard call, because I think you're better off not having it. On the other hand, people that don't use birth control get pregnant. I mean, if you're relying on condoms, it's not 100% for sure. And, withdrawal method is like, that doesn't work at all. So if you don't want to have a baby, you kind of got to be on birth control. And, I get your point as why the girl's always going to be responsible, but I don't think, men, unless they're willing to take the long-term responsibility and get a vasectomy, there's nothing besides condoms that I'm aware of for men not to be able to impregnate a woman.
Mm-hmm. Oh, for sure. Just curious. What have you seen are some ways that we can help support our hormone health and improve overall balance? I mean, in addition to BHRT, that's, obvious.
No, for sure. I think diet's huge, The biggest organ in the body generally is people's fat, and fat stores estrogen, which is really bad for men to have a lot of estrogen floating around, but women too, because it's not good estrogen, and it makes them feel better. So controlling our diet so we're not obese, that's one thing that's very helpful. Secondly, I think exercise. Exercise makes everything kind of run better. It certainly helps mood feel better, and I think mood has a lot to play as far as hormone production, and then hormone production has a lot to play as far as mood goes. So they both work together. But I think those are the two things: is diet and exercise. Eating cleanly, and not just eating a little, and not just being skinny, but eating good food that's nourishing and helpful.
Mm-hmm. No, definitely.
I had a question, and it's only because I get asked this question a lot. I work out. I'm at the gym all the time. I'm around a lot of fitness people, bodybuilders. I guess my question is, maybe more so to counsel men who, I want to say maybe younger men, who do the testosterone, unmonitored, or the steroids, right? What would be the long-term effect for them using that at a young age that maybe you could educate them on, or maybe just for them to take into account,
Well, certainly the short-term effect is lack of production of your own testosterone. So when you stop, when you take exogenous testosterone and all of a sudden you stop taking it, and then you don't produce as much because there's a negative feedback, whereas where the body senses, there's tons of testosterone, we don't need to make any, so it shuts down the little factories, being the testicles, and those testicles shrink and become less efficient and everything like that. But if you're given lots of testosterone, it doesn't matter, but as soon as you cut that off, you make less, and so you can end up being a little bit of a mess. As far as the anabolic steroids, the big problem with that, being unmonitored, is a lot of people think more is better. Mm-hmm. So they take more and more, and they could damage their liver, they can damage other organs. So that, if you're going to do that, at least get some labs or something just to make sure that you're okay. And moderation, because most people that we always think of that in athletes, they're all taking this, but I read somewhere it's like 95% of people that are doing that don't play a sport at all. They're just men that go to the gym, and I want to look better,
stronger,
and so I'm risking, my health with anabolic steroids, unmonitored, not even knowing the quality that it is, et cetera, et cetera.
And that's huge. I feel like a lot of people think they can trust everything online, right? But it's like, you don't know what's actually in it. You don't know what you're actually injecting yourself with, or how clean it is, or what facility it was made in, especially when it's not through an accredited lab, So I think that's the scary part, even with like peptides, which are usually pretty harmless if taken correctly. But there's a lot of different peptide options out there on the internet, and you just never quite know what you're injecting, or if it's as potent and effective as it should be for what you're paying.
So here's an example. This is just kind of funny to me, but so I had a friend I used to lift weights with, and he said, "Pat, let's take some trenbolone." I got some. So what we have to do is we get it at the veterinary store.
Oh, stop it.
And then we'll boil it down, and then we'll filter it out with a filter, and then that one we'll inject it in ourselves. I said, "Are you freaking nuts? What are you thinking? We're going to just inject something in our body that you get at the veterinary store, that you got to do all this. I'm not a chemist, and I don't know how to manufacture medications. What are you? You're nuts, man." And this was a friend of mine who really, he was a big guy, but he didn't like to work out. He would just take stuff and get bigger,
less work to get the same.
You know who he is, and anyway, it was just kind of like, he was telling me that, and I don't think he did it. We're kind of like, no. That's crazy talk.
Not a good idea.
So I think you got to be safe, and for the most part, I think a good diet, making sure your testosterone levels are good, you'll get pretty good gains. And there's some SARMs and other things that are legal that you can use.
Well, even the peptides that you offer, like the tesamorelin, the growth hormone boosters that you can take, and cycle. I feel like that really does help to lean people out and to grow muscle if that's what you're wanting.
Absolutely. But certainly you don't want to risk your health and well-being for some cosmetic results that aren't lasting.
Or have long-term effects because of it, like you're seeing your organs. And
Right. Well, but they're studying Olympic athletes who are willing to give years of their life off if they could win an Olympic gold medal. So I don't know what's worth it to you that you would give years of your life to have, but I don't know. I can't think of a lot of things that I want that I can't get myself.
No, definitely.
What are your views on physical movement and exercise? What would you say would be the best approach to keeping the body in its best physical state?
Well, I enjoy weight training, and I've competed in powerlifting, and I think weight training is like one of the very best because it'll help maintain integrity of your bone, it'll limit osteoporosis. Just being strong helps you to be able to get up and to do things. And they've done some studies showing that elderly people that are able to to walk and do things just live longer and have more productive lives and feel better. So I think certainly resistance training anyway, it doesn't have to be weights, it could be bands, it could be different things, is good. I think playing sports is great because it's fun. And I've never been one to be able to train some people can train, they're so disciplined. I'm going to train to be able to just look good, and I do this every day, and I've always liked to prepare for either a contest or something else. So,
like establish a goal.
Right. But so I think sports are good in that way, so that gives you goals, and that makes you want to stay healthy. And shoot, I got this, half marathon. I don't want to be 20 pounds heavier because it's going to make it so much harder. I think that certainly endurance training, aerobic training is also extremely important. Really great for cardiovascular fitness and health. Those are all the things I personally feel like a nice, well-balanced program eventually where you can do all three. And you would tailor how much you do of one or the other depending on your activity level. Like if you're a mountain climber, you don't need to be huge. You want to have some strength to be able to climb, but you want to have big lungs to handle it. If you're playing soccer, you're probably somewhere in between. If you're, if you're powerlifting, you're going to want to be more on the strong side. But the endurance level is important just for getting around day to day and not feeling tired all the time.
Well, and I feel like people use exercise for so many different things, like even emotional, mental well-being, like that clarity or to soothe anxiety. It's like, I think you have to find your mix of like what works for you and what helps you overall, obviously on a physical level, but also even on a mental level. I know you've talked about how, exercise and doing that regularly helps you feel sane.
But it's also kind of a bittersweet because I just weight train and I feel like my flexibility is not up to par. Like I probably couldn't play a sport right now just in the fear of like pulling something because I haven't done that movement in so long. So I get that, it needs to be tailored more specifically to the individual. Like I used to do yoga before I did weight training and I was much more flexible, but now I feel like if I could just balance the two, or maybe just incorporating more stretching and more like recovery, probably be in better shape.
I think as you mentioned that, it's like you can do yoga or you can do stretching, and you don't have to do it so that you could become a yogi.
Yeah.
You're not worried about, I need to be a great yoga person, but you need to be flexible so you don't injure yourself in the weight room, etc. But I just think doing a variety of activities. I also read this one article where it talks about mitochondria. They're kind of the powerhouses of its cells. And so when you exercise a lot of different things, you do a lot of different exercises that exercise a lot of different muscles, it's really way more healthy. It's good for longevity because it gets all those mitochondria to fire in all your cells. So like doing things, not just one thing, or maybe a few specific exercises, but doing a lot of different things, and will help you not only just help you feel better. And going back to the stress thing, I know for me the exercise is really great for reducing stress, because when you don't, you are more stressful, and second, you don't sleep as well. I mean, you're not tired at night. Physical activity is good to get you tired, and so if you're not tired at night, it's really hard to fall asleep. I think most people with insomnia, and I don't want to say everybody, aren't that active during the day, and so they're just. But if you get pretty darn tired, I sleep better.
Yeah.
Well, I personally love like having a regular working, weightlifting routine, and then trying in a sport. Like, I try to do that a few times a year. Like I've done softball leagues and even just finished up a co-ed soccer league. And I like it because it's challenging. It makes me feel all those muscles that I haven't used in a long time. And then it makes me want to keep, challenging my body in different ways. Yes. And then, wanting to maybe alter my workouts to cater to that. But I like that kind of shocking my body in a way. I went on this backpacking trip with my husband like a month ago. And that was very insightful. Like I've never carried, like a 60, 70 pound pack and like gone for miles, like uphill, but I did it. It felt awesome. I felt very accomplished, being able to do that challenge. But then it gave me some more motivation. Like, girl, you're not as fit as you thought. Let's go. Let's keep working out. If we want to keep hiking and, having energy, because it's a lot easier to hike uphill when you have that energy those muscles. But I feel like sometimes people overthink it, like what they should be doing. And it's like, just move, like do something.
Well, I think if you can do exercise for 60 days, you get addicted.
Yeah.
And it's like then when you miss it, you're like, it's not the same. I need to get back at it and do it. So just keeping a habit for 60 days, I think, is a good period of time. I know they say it's less, but I think that's a good time period. And then it's a good addiction, and then adding all the things you want to do and accomplish, setting goals and accomplishing them is great.
So how would you describe the importance of mental and emotional health and the impact that it has on someone's overall longevity?
Oh, I think it's extremely important. I have a few of my pain patients who say they pray every night that they'll die before they wake up. I mean, that can't be good for your longevity. They're so sad. And what kind of existence is that you feel so sad you wish you were dead? I mean, certainly you want while you're alive it to be, happy and exciting and good. I mean, we all have sad moments, but not where your whole life is just one long sad story. I think it's really important. Your cortisol levels go way up when you're anxious. So keeping those cortisol levels down with exercise and calming and stuff like that. I don't know. I just think it's better. It's better for brain function. It's your cells just work better when you don't have that stress all the time.
When you feel emotionally overwhelmed or taxed, it's not like you're like wanting to try new things or be sociable or do things that actually bring you joy. And so it kind of is very limiting as well when you're not mentally like clear or in alignment.
Yeah, and we all have things that happen in our lives that make us depressed at times, but the thing is not to get caught up in a long-term depression. And so one of the things I've been thinking a lot about, and I don't know that this has to do exactly what we're saying, is don't worry about things that are out of your sphere of influence. There's so much stuff going on in the world we can be sad about. What's going on in the Middle East, the war in Ukraine, China, they're going to have warships and whatever. I mean, all these things we can be upset about and angry about and things like that. But your ability to influence them are zero, is zero. So it's better to worry about how can I help my neighbor, who can I be kind to? Who can I be loving to? Whose life can I help change?
Well, and allowing yourself to be aware of those that are doing that for you. I feel like sometimes we block out when we're upset or sad or anxious. It's like we don't even want to acknowledge all the good things going on because we're trapped in focusing on the bad things and dwelling on those. And I feel like that's a very stoic principle, and I really like that about, focusing on what's in your control, because it's such a waste of energy and even thought to be dwelling on things that you, like you said, have no influence on.
Well, and there's something called confirmation bias. So if you think the world sucks and then you have a bad experience, see, There's another example. That's another. So all you see is the bad stuff in the world. You don't even see the good stuff because that's kind of out of your view. You're seeing bad stuff, and that's just confirming how bad the world is and why you should be so sad and everything like that. So I think getting out of that mindset is really important.
Well, I feel like working with Lisette, I've really realized that we are all kind of looking for confirmations of our beliefs in a lot of different ways. Like, oh, every guy cheats on me. And it's like, and then your mind is looking for ways to prove like, yes, they do. Or, and that's a silly example that I'm not necessarily worried about. But it's just interesting how optimizing your thought processes and like looking at things again will help you want to create new beliefs, and then you can confirm those positive beliefs instead of being stuck in that cycle of negativity or things you've seen in the past.
I like to see it as like law of attraction, right? What you look, or what you put in, you will receive, but also what you look for, you're going to find, So it's like, if you're focusing on that, you're going to see it. It's going to come back to you.
Well, worrying about if someone's going to cheat on you, there's not much you can do about that.
Right.
All you can do is be the best person you can, looking for love, everybody's going to be happier and less likely to do bad stuff.
Well, and I've heard you talk about that concept of like casting a spell.
Yeah.
Do you want to explain what that is?
Sure. It's in a book called The Four Agreements, and it's a great book, but a lot of times we cast spells on each other, especially like our children. Like, you're never going to learn math. We might say that to our kid, you're so bad, you're never going to, and then all of a sudden the kid believes it. And it's like, and then they never learn math because they feel like it's out of their realm of ability.
Or they assume he told me I suck at this, so I'm always going to suck at this, so why try?
And if you think about it like casting a spell, and we all think, oh, witches, this is silly. But no, when we start saying negative things towards other people or towards ourselves, I think we can cast spells on ourselves. We start saying things becomes part of our belief systems, and if you don't think you can, you can't.
And it's very self-limiting. And I feel like especially in a relationship, I guess I've seen, with my husband, if I'm always looking at him like, you suck, you never do anything for me, it's like, guess what, he will become that person because I'm treating him like he's that person. So it's interesting, that cause and effect like you're talking about.
Well, you can't ever do anything right. Well, then he ain't never going to do anything right. He's just kind of like, he's going to try, but he's going to, I know I'm going to fail. I feel like Eeyore, and Winnie the Pooh. Oh, well, it's a sad day. I can't do anything right,
Words have power.
Yeah.
So is there anything that you recommend for your patients when it comes to stress management? Supplements, tips?
So exercise I always recommend, but my favorite supplement is ashwagandha, because I think that really helps as far as mood and it's just kind of reducing anxiety. It's really great. Almost every person who has elevated cortisol levels, which is usually due to stress, I'll recommend that they take ashwagandha. Other things are licorice root. That's another one that works pretty well, but ashwagandha is kind of my go-to.
And even CBD, I feel like that's everywhere.
For sure. And there's peptides that kind of help with some of that too. And I think C-Max and C-Link are good for depression and mental clarity and function.
Love that. I've been taking the C-Max C-Link like nasal spray peptide, and I feel like it really helps with ADD, with stress, anxiety. I've also been experimenting with Transcription's Kava Calm, and we carry that at Ego, but it has like kava, it has CBD, it has a couple other, a GABA in there, and I feel like that really helps. I like taking that at like the end of a work day, like before I drive home, and then once I'm home, I'm like pretty chill. Not like exhausted, like I want to sleep, but it's like very like calming in a nice way.
Yeah. What are your thoughts on trauma and the notion that it can be stored in the physical body?
Well, that's interesting. I do believe there's trauma. And I do believe it can be restored in the physical body. Because there's just so many incidences of it, lady I saw today who had some very significant trauma, and I've sent her 2 times to see Lisette. She's had some physical traumas as far as her health goes, but also some abuse issues and stuff like that. And just sad, has pain all over. I think it manifests itself in a lot of different ways. I think it can manifest itself with disease, manifest itself with pain, manifest itself with depression, and clearing that is not easy all the time, but certainly worth it, because I think at least clearing the effects of that trauma can get you to a baseline where it's easier to treat. I think even, throwing medicines and all kinds of stuff at it, like I can give pain medicines to you for your pain, but if you still have that trauma stored in, that's not making it go away.
Just numbing it.
Yes.
No, I think a lot of people don't want to recognize that that's a thing, but I'm like, no, I feel like trauma definitely is stored in various parts of your body.
Well, the problem with it is it's painful to an extent to get rid of. You have to do work. It's not something you can passively do. Give me a pill and get rid of the trauma that's stored within me. You have to do work to clear it. You have to forgive. You have to forgive yourself for thinking it's your fault that this happened to you. And I don't know, you just kind of overcome and realize that I'm a good person. I'm not a bad person, and I don't deserve this horrible life that I have, that's going on because of all these horrible things that people have done to me in the past. So I don't know, I think it's a really key point.
Well, I think the mind is really good at protecting us and shielding things, and like, oh, just don't look over there, don't look at it.
Absolutely.
And I think the mind is very efficient in that way, but I think when you take it upon yourself to like dive in and not be scared of what you're going to find or what you're going to see of your past or what's happened, I feel like beautiful things can happen. You can rewire your brain and create a new path on like what you think of the world and your existence and what your goals are even, but you have to be willing to like look at it and open it up.
Feel your feelings, you have to be able to feel the pain and whatever's going on so you can face it, I think.
Yeah.
And this is certainly something I would leave to Lisette to address. But I think it's really, really important to get rid of that if you can.
I agree. So holistic medicine often makes an emphasis on spiritual health as a component of achieving overall wellness. What are your thoughts or approach to improving spirituality for your patients?
Well, it depends a lot on how you define spirituality. I have my own religious beliefs and spiritual processes, but I think certainly people need to find God and find beauty and trying to be a good person. And I believe there's agnostic and atheists that are really good people too. I'm not trying to, I don't know, I think we really have kind of a holy war going on right now, especially amongst certain religious groups and look what's going on. Absolutely holy war going on right now in the Middle East, but even here in the United States, people of different religious orientations looking down upon others instead of, I don't know. So here's an example. I had a lady some years ago whose son committed suicide, and she was so sad. And then she goes, and the pastor will not let us have a funeral at the church. And he told me my son's going to hell.
Wow.
And she was so sad, and she's sitting there sobbing in my office. And I basically said, first of all, funerals aren't for the people that die. They're for everybody else to mourn and enjoy with them. Second, who's he to judge? I've never read the Bible that says you commit suicide, you're going to hell. Third, who is he to judge anyway? If you feel if you're a Christian man, like he supposedly was, Jesus Christ is going to judge you, not him. I don't want that responsibility to determine where.
I don't want to make that call.
No, that's not something I want. And so I don't know. I just didn't seem kind to me. And I think you really got to look at what's kind and what's beautiful and what will bring peace and what will bring joy and happiness. I have found a lot of, I guess we'll call it comfort and reason in Buddhist teachings. I'm not Buddhist and I don't profess to be Buddhist, but there's so much peace and happiness in a lot of the things they teach. And Ariana talked about some of the Stoics, and some of that stuff makes so much sense. There's a lot of really intelligent people out there. So I guess I've really said what spirituality is, but for me, it's just, finding your best self.
Well, I think a lot of the times I have conversations with people, and it's like focusing on that bigger picture and allowing there to be more.
Yeah.
I feel like when you have hope in whether it's, life after death or God, source, whatever, I feel like it gives you a different perspective. Like the right now feels less consequential and less important when you realize like we're all intertwined and there's things to live for, there's a purpose to have. And I feel like a way to enhance your spirituality is by, through meditation or prayer. I feel like prayer is a form of meditation, even being grateful and having gratitude for what is going well in your life. I feel like all of those things make you feel like you're a part of something, like you have a sense of community, you have control over yourself and what you're kind of creating. And I think sometimes people forget those simple things can make you feel a lot more calm.
Yeah.
Well, personally, I feel we're all God's children. And he loves each and every one of us, even the people that don't have the same religion as me, or the same belief system or whatever. So, you got to look at that. He loves them all equally. He loves us all equally. And we got to do our best to get back to him and to do what his will would be. And I think that's what's incumbent upon everybody to figure out, what's the best track I should take,
Mm-hmm. I always saw spirituality as, active things that I could do to fuel my spirit. I believe that I have a spirit in my body and that it is my life source. So in the sense of aligning with it, I believe that, my spirit is good. It has good intentions. So I want to align my body with it so that way my actions reflect on what I carry inside. Mm-hmm. And I don't know if you guys watched the Netflix series How to Live to Be 100 in the Blue Zones.
Mm-hmm. No,
I haven't seen it. Yeah,
but it's basically taking, there's different areas around the world that are the blue zones where the population lives to be like 100 and plus. Yeah. But it was basically taking all the common factors of each location and what are they doing that is helping them achieve that longer lifestyle. And all of them had a sense of spirituality, but they kind of just, referred to it as different things. Like in Japan, it was your ikigai. It's basically like what is your purpose? What gives life meaning? Costa Rica had another one, and it was like plana de vida. It's basically just what is it that fuels your soul? What is it that brings you genuine joy? And I think that was very relatable, that I feel like is safe for everyone, whether it was God and doing service or if it was, them just having a hobby that brings them, a lot of joy, like playing the violin. Like I love to do this and I share it with others. I feel like that's all things that overall fuel the spirit, and so I think that's how I would define spirituality is, what do you do that makes you feel whole?
Well, and I think even, with working with Lisette with consciousness coaching, it's like allowing yourself to reevaluate every once in a while. Mm-hmm. Like it's not okay to just do it once in your life. Okay, these things are important to me. I'm going to act in this way. But it's like checking in and being like, do I like the person I am?
Yeah.
Like, let me look at myself, the good, bad, and ugly, and know that I can adjust the ugly, the parts of me that I don't like and turn them into positive traits. But I think a lot of times people are scared to give themselves a genuine look.
Yeah.
And they only focus on the good things. But if you're not in tune with yourself, like you're saying, in alignment, how are you going to know what you need to adjust or even what you're doing well?
Yeah.
I feel like it's okay to do that personally or with your relationships or people you're surrounding yourself with. Like, is this what I stand for? Does this make me feel good? Do they represent themselves in a way that I respect and want to be around? Mm-hmm. And am I that person that they're going to want to hang out with too? And I like how you're saying like being in touch with and in alignment with yourself so that you can stand behind everything you do and live with real intention.
Yeah, for sure. Well, I think that wraps up our episode, right?
Yeah, I was going to tell you that.
Time.
Well, we appreciate you, Dr. Rhoades, coming in on the podcast. I feel like we always learn things and get to discuss some fun stuff. So,
well, thank you. It was my pleasure to be here, and I really appreciate these podcasts and all that you two do.
Yeah, a lot of educational content in this one. Thank you so much.
Yeah. Thank you.
Thank you for listening to Awaken Your Ego, a podcast that explores biohacking and self-discovery. We hope you follow us on Instagram and Facebook to stay up to date on what we're working on in your area.